time to Pinky when I have finished, introducing myself. All right, so so I have been actually with Mind Hong Kong for 1.5 years now, and so I'm actually the Cool Minds project manager, which Cool Minds is actually a joint initiative between Kelly Support Group and Mind Hong Kong. So me myself, I am actually a certified mental health first aid instructor, as well as I have contributed in the NGO field since graduation for several years, serving the underprivileged community, especially those with special educational needs, as well as mental health issues. So over to Pinky to introduce herself as well.
Sure, thank you, Nicole. Hello, everyone. My name is Pinky. I joined Mind Hong Kong in the year of 2019 as a volunteer, and now I'm the content advisor of Mind Hong Kong. My current work focuses on health education. I'm passionate about helping people to improve their life quality and happiness with my experience as a business executive and a health educator, especially those who are struggling with mental health challenges. Like Nicole, I'm also a certified mental health first aid instructor and has provided online and in-person training on various issues relating to mental health to the public, schools, as well as corporations. In addition to serving Mind Hong Kong, I'm also a part-time lecturer teaching master's degree courses relating to sport and health at the Hong Kong Baptist University and the Chinese University of Hong Kong. Back to you, Nicole.
Thank you, Pinky. Just a little bit of my background as well. I'm actually doing the Master of Social Work currently part-time at HKU. So I will be a social worker in a couple of years. So in the meantime, I am happy to be sharing with you, with Pinky as well, the it's different kind of knowledge of mental health and how we can better support students when the school resumes to in-person learning. So because we have seen a lot of different sad news recently of students taking their own lives upon returning to school. So we think that this is actually a great chance for educators to review and reflect how we can also support the students in need at school. So that's why we have actually, this is one of the goals of Cool Minds, is to help youth and those around them, parents and educators included, to understand what mental health is. And so we provide different kind of in-person or online workshops for schools. Our primary age target group is actually aged 14 to 24. But this webinar, this is actually for educators of both primary and secondary schools. So we think that this is actually, hopefully it will be helpful for educators to know how to access help when needed. And so today's plan, we will be talking about some mental health impact of COVID-19 and how distress impacts learning, and then how we can support young people's return to in-person learning, and some tips for educators to take care of themselves as well. So to start with, we would like to ask everyone to maybe use the chat box to tell us what comes to your mind when you think about mental health. Or you can also just unmute yourself and say it out loud. Feel free to type it in the chat box as well. So what's the first thing that you come to mind when you think about mental health or someone with good mental health? Stability, yes, in terms of like perhaps emotional stability or health as well. Being emotionally stable and able to handle changes or problems. That's very true. Good stress management, well-being in heart and mind. Yes, so related to emotional stability is actually how we handle our stress correctly or properly with methods that actually apply to ourselves. We all have different kind of coping strategies. So we will be talking about different kind of stress coping later on. And yes, it's a continuum, ups and downs. Self-care is important. So thank you for your response. We will be talking about, some of the good mental health, elements, with people with good mental health. So what is actually about being mentally well? Well, good mental health is not the absence of mental illness, but rather a state of well-being. So remember, being mentally healthy does not mean that being happy all the time. So the full definition of mental health, according to the Mind UK, is actually we have 5 different elements. The first is that you feel relatively self-confident in yourself. So you value and accept yourself and judge yourself on realistic and reasonable standards. And secondly, you feel and express a range of emotions. So that's the ability to actually being able to express yourself and to acknowledge your own feelings. And thirdly, it's about you feel engaged with the world around you. You can build and maintain positive relationships with other people, and you can contribute to the community you live in. So you're very, in terms of like connecting with others, you can actually contribute in your own community. And fourthly, it's about living and working productively. And lastly, it's someone have also mentioned this, you cope with the stresses of daily life and can manage times of change and uncertainty. So with the current situation in Hong Kong, with social unrest in 2019, and then going from 2020, we have the COVID-19, you will notice that some of or all of these have been impacted and therefore affecting your students' mental health as well as your own as well. So we actually want to share with you what mental health is actually affected by. So psychologists actually use what we call the biopsychosocial model to understand an individual's mental health. So for biological factors, it can be like disability, physical health, genetic predisposition, etc. So it can actually have, we have research supporting that some kind of schizophrenia or other kind of depressive or anxiety symptoms, it can have biological factors. And secondly, it's about psychological factors, for example, your self-esteem, your coping skills. So this is going back to how you cope with the daily stresses of daily life. So this is about resilience. And different people have different kind of skills. And so that's actually one of the factors that affect our mental health. And then for social factors, it is about family circumstances and peer relationships. So how we interact with our friends, our family members also affect our mental health. So some factors sit across 2 sections, for example, like trauma, the effects of drugs and IQ. So it's actually, this is all interrelated, and you can see that we have stigma in this model, which is a feature that actually lying in the social section segment, where how people in the society view us as, maybe having mental health situations could actually affect our own mental health as well. It's about discrimination or behaviors of, how people actually negatively view us or judge us negatively. So this is actually an important factor falling in the social section, but also affects other sections as well. So, but this webinar, we are not going to go deeply into stigma because of time, but we would like to share with you mostly on, how distress of COVID-19 can impact mental health. But it's very important for us to understand that sometimes we think, oh, we have poor mental health because we can't cope with the stress. We don't have the ability or we are too weak to do so. But sometimes we have to understand that it's actually affected by multiple factors. For example, biological, maybe predisposition. It's actually they are more prone to developing a mental health disorder than other people. So we have to bear in mind this is actually a biopsychosocial model that we're talking about. So COVID has actually had a lot of different impact, but three major impacts are actually stress, increased stress levels, anxiety, as well as low mood and isolation. So we will look at these concerns more closely and how they relate to COVID. For example, like increased stress, like facing changes in learning mode, class schedules, etc. And then we have social distancing, which can actually affect our, feeling of isolation or, being very low mood all the time because we can't get out to play with our friends anymore. So before we go into details, we want to share with you some of the statistics that we have on hand related to youth mental health in Hong Kong during the COVID pandemic. So first thing to bear in mind is that actually 75 of all mental health disorders develop before the age of 24. So that's around, majority of the mental disorders is actually during adolescence that they develop. So this can result in lifelong impacts on both mental and physical health. So that's why it's important to identify students who are struggling early and provide appropriate support. So this is about early intervention. A majority of students who are struggling do not seek help from those around them. And the ones who do will reach out to peers and social media. They may not really talk to the adults around them. So because of stigma again of the society and the perception of the support that they will receive. And so it's also important to understand that the caring adults around the young people, our students, we have to show them how important mental health is and that it is okay to ask for help. So we have like a statistics in around 2020 that 50% of the young people reported symptoms of depression under COVID-19 in Hong Kong. And then 48% reported relatively high levels of stress. That's according to the Hong Kong Federation of Youth Groups. That's quite recent with statistics in October in 2021. And then 60% of the students do not seek help when struggling with their own mental health. That's actually according to a statistics survey by the Kelly Support Group in also last year. So this is actually all very alarming statistics. We don't want to know that's actually happening in Hong Kong. And so we have to actually first understand how COVID and mental health is related to each other. Well, for this part, I will pass the time to Pinky to share the negative impacts of virtual learning.
Thank you, Nicole. Just looking at the statistics provided by Nicole, I'm sure all of you are aware there is a strong association between the pandemic and mental health. So basically, virtual learning during the COVID pandemic phase has been highly disruptive to student learning and their mental health. I would say for in-person schooling, as a matter of fact, they are not just offering students the learning opportunities. In-person schooling, as a matter of fact, they also offer a chance for students to work things out together, to play together, and enjoy social relationship there. So without the in-person schools, then students have to be kept at home and rely everything online, and that is not helpful. Virtual learning and unpredictable changes to the school schedule, as a matter of fact, have added to students' stress levels for many reasons. Some of them include like they lose their chances of getting together with their friends. They lost the chance of social functioning. That may also impair learning as well, because they don't have their buddies learning together with them. And sometimes because students have to stay home most of the time, that may increase the risk of family dysfunction as well. So let's take a minute to talk about stress. Now, I'm sure that for all of us living in Hong Kong, we all know how stressful it is to stay in Hong Kong, because we have long working hours and most of us live in small spaces, and many other factors like busy working schedule and a lot of different cultures sometimes may increase the likelihood of stress in our lives. So stress itself is not necessarily a bad thing. It is usually triggered by what is happening in our lives, and it is normally short term. Many people find, as a matter of fact, a bit of stress help them to get things done. For example, when someone prepares for a major project, when the new examination is coming, people are motivated to finish things on time. So stress becomes a problem when it is prolonged or when you are not able to cope with it. We all go through ups and downs, as Angie mentioned in the chat, that our stress level do not just stay at one point. It is pushing up and down, and this is not necessarily a problem. Stress itself is not a diagnosable mental health problem, but remember, chronic high stress that is not addressed can put all of us at greater risk of mental health problems. So we have to be aware of that. Now, a lot of time, stress, as a matter of fact, comes from different types of uncertainties. For example, at this moment, distressing alerts relating to pandemic, frequent changes about the social measures and the government regulations, a lot of changes on school scheduling, delay of examination schedules, a lot of concerns about being infected or being exposed to COVID-19. All this can bring uncertainties, which in turn would derive a lot of stress on most of us. So at this moment, students are returning to school. So what does that mean to us? The measure for pandemic have been relaxed and school reopens. And now that students suddenly have to change to a new environment again. This big change, as a matter of fact, can create a lot of stress to students. They are facing a lot of uncertainties again because of the opening, or I would say the reopening of schools and offices. For students, for many of them, they are afraid of not able to catching up with the materials. And a lot of times because parents think that, oh, it's a good time for students to get back to school. And they may impose very high expectations on the students. So all these pressures may come up from the schools, which affect the students. And a lot of time because they come back to the face-to-face interaction. And a lot of students, they are not ready for that yet because they have been staying home and trying to interacting with each other online. But now that they get the chance to go back to the face-to-face social interaction, that may cause a lot of fears upon students. So as parents, we have to be aware of that. After we talk about stress, let's take a look at anxiety, okay? I would say anxiety is a very common mental problems. There are a range of anxiety disorders, but you probably have some kind of experience, which a lot of people, they talk about, social phobia. They are feared of being within a great number of friends or social situations. Another common anxiety would be like generalized anxiety disorders. They are just anxious about everything. And another most common kind of anxiety is panic disorder. Anxiety is a normal reaction to stressful situations. But when anxious feelings of worry and fear persist and can't be controlled and cause a lot of major disruption to your daily life functioning, it may be something like an anxiety disorder. So because of that, let's take a look and be aware of some of the warning signs of anxiety. Normally, on the behavioral side, most students and sometimes parents or even educators, they find themselves difficult to concentrate. And because of that, they are not able to finish their normal tasks. They would also have problems in sleeping. They try to withdraw or avoid any kind of social situation. Some of them, they may utilize unhelpful coping strategies, something like they make use of drugs, they make use of alcohol, or having a lot of coffee every day just to calm themselves down. Some of them, they may even have excessive thinking of worrying about everything. Then how about on the physical side? I don't know how many of you have heard of the term, we call it the shaky man or the jelly man. When someone is anxious about something, they may feel on edge. Their muscles are sore. They have chest pain. They have a lot of pains like headaches, stomach ache. Sometimes they may be running short of breath. Their heart rate increase, and they don't have the motivation to work on anything at all. So they feel tired all the time. So this can be warning signs of anxiety. Now, just like stress, anxiety is something that students may have when they return to school after the pandemic. Before I talk about more on anxiety, let me share with you some statistics on how COVID-19 affects our mental life. Top COVID-19 related factors which respondents reported during a recent research conducted by Mind Hong Kong in March of this year, they show a lot of negative impacts of what has happened during the pandemic with mental health. And these factors include like fear of friends or someone that you love to get infected with COVID-19. Respondents show 64% with that kind of fear. And also about 63% of people, they are feeling anxious about being placed in isolation or quarantine in a hotel or a quarantine institution. We also have over 60% of people think that they are feared because they cannot see their friends as often as they want to or as they used to. And they can't get out as well, because in the past, whenever they feel down, they would get out with their friends. But during the COVID, they are afraid of getting out. And a lot of people, they also feared about being diagnosed with the COVID-19. And I would say also about half of the people, they also show concern of not being able to take part in the sports and exercise that they used to do before the pandemic. Now, how about the parents' side? We also, from our study, we also show some negative results. We are even worse as compared to a survey by WHO. For example, WHO has done a survey on well-being using the WHO-5, a well-being index scale. As a matter of fact, we got 59.1%, which is even lower than the study done by WHO, which showed 52 out of 100. Coming back to anxiety, as a matter of fact, anxiety, when the students return to school, that may include a lot of uncertainties during the transition, such as the examination assessment methods may be changed. There would be a lot of COVID measures from the schools, and there would be a lot of social anxiety. And students, when they return to school, they may also get worried about, oh, my friends or my classmates may pass on the virus to me. And they themselves, they also have great fear of contracting the virus. A lot of people, they also showed anxiety about the vaccinations, especially on youth, about the Sinovacs. So at this moment, planning for future has been difficult for all of them, including parents and educators, about the school schedules, about what can we do, because a lot of time is beyond our control. It really depends on whether the 6th wave will be coming back. So pandemic fatigue is something that a lot of us, because of different measures, this is what we have during this time. But this is normal and understandable. And we are getting exhausted over time with the new COVID policies. So we have, as parents and educators, as well as students, sometimes we need to be more resilient or more flexible about all these changes and uncertainties. Another topic that I want to talk with you is isolation. As a matter of fact, brings loneliness. Isolation is a big thing during the pandemic. We are all human. We are all afraid to be trapped at home. And because of that, we can't continue with our social interactions and our feelings on connections with our friends as we used to in the past. Because of that, a lot of students, including the adults, may spend more time online and on social media, increasing the risk of social media fatigue. And as we are getting tired of the communication channels through online, this would affect our mental health seriously. And because of loneliness, it also affects our mood problems as well. From different statistics, it also shows that students have already got a combination of anxiety and depression during the pandemic. Let's move on to depression. Now, as a matter of fact, stress, anxiety, loneliness, and those things that we just talked about all may lead to depressions if you don't know how to handle it well. Depression is more than just feeling sad or upset. It is a serious medical condition which makes coping with day-to-day life harder and leave us feeling down most of the time. Depression is when feelings of sadness, emptiness, and irritability last longer than 2 weeks. Normally, we use 2 weeks as a benchmark. If more than 2 weeks, if you still feel your sadness, your emptiness are affecting most parts of your daily life, such as school, your hobbies, getting together with friends, work, or something stopping you from working with those things that you used to enjoy, you have to be careful about it. As parents, it can be hard to tell the difference between the up and down of being a teenage and being depressed. So that's why you have to be paying higher attention to teenage, especially during this time. Now, let's take a look at some of the warning signs that I would suggest parents may try to be observable. A person who is depressed sometimes may not show signs of depression, but they may start to behave a little bit differently. Sometimes a minor physical problem may be used by teenage as a disguised appeal for help. Now, on their own, these behaviors don't necessarily mean that a person is depressed, but they may be a sign that it can be a more serious problem at a later stage. Some students who may experience depression may not show any of these symptoms, or I would say these typical symptoms that you can now see from the list. They may have normal level of energy and are able to go about their normal activities without too much trouble. This is sometimes referred to as smiling depression, but do not confuse it as a different type of mental illnesses. This is still depression, only without the usual symptoms. The main thing to notice is drastic changes from their normal behavior. Due to their higher energy level for the teenage, they are also at risk of taking their own lives by suicide. If you suspect someone may be showing signs of depression in this way, please try to get help or reach out. It may be quite common in Hong Kong or Asia due to our culture, because we don't want to talk about mental illnesses in our community that show negative emotions, because we consider mental problems are something bad in our culture. So that's why younger people tend not to show warning signs of depression and still perform quite well academically. And sometimes they may still look like they are cheerful, they're having no problem at all. But as a matter of fact, if you pay more attention on that, as parents, you should be able to identify some kind of changes in their normal behavior. So now let's move to talk about the distress. How does distress impact the student learning? Now, basically, these are the 6 major impacts on learning. The first one is engagement. Both anxiety and depression impact a student's ability or their motivation to engage in their normal activities, both academically and socially. Another thing is about the concentration, whether they are able to focus on the things that they need to do. Mental health struggles impact ability to focus due to preoccupation with all kinds of anxiety, with all kinds of excitement or negative thought patterns. Let's take a look at attainment and progression. This can affect their engagement and especially on the cognitive functioning as well. This in turn would affect negatively the students' development. Another thing that may affect learning is the energy and the enthusiasm on what they want to do. Mental health itself struggles would disrupt the sleeping pattern of the teenage. Depression and anxiety also impacts their ability to get excited about things. Last but not least is the social functioning, which is very important amongst teenagers. Both anxiety and depression can impact the students' ability to engage in the social environment in their network. The pandemic has worsened this due to the isolation and the remote learning because they can't see their friends as often as they want to or as in the past. Other than these 6 major points, I would also like to talk a little bit more about cognitive impacts. At this stage, especially with the COVID, now that they're returning back to school, it may take some time for them to get back to their concentration, and they may need time to settle down with the memory, with their behavior, with their confidence, and to get used to the social situation as well. Cognitive impacts of mental health, such as the ability to focus and memory consolidation, can be due to both thought distortion and bad sleeping quality. So at this moment, let's move to another topic on how to foster positive mental health. And Nicole will be sharing some of her experience on this subject.
Okay, thank you, Pinky. So we have learned a lot about different kind of stress, anxious feelings, as well as depressive thoughts, how it can actually affect the students' mental health. But as educators and maybe parents, some of you parents as well, it's also very useful to know how to foster positive mental health during difficult times. So we will actually have in the next few slides 2 simple activities that we would like to share with you so that you can actually do with your students at school. And we will also share a pack of activities which support positive mental health and positive coping strategies. So to foster positive mental health during difficult times, it's very important for educators to actually set clear expectations. So this is actually about, setting realistic expectations, not just clear, but also, how we are actually adjusting our expectations when school resumes to normal after long periods of online learning. Because, students are actually dealing with a lot of transitions and changes, and this is actually a very critical time for them to adjust to the new learning environment. So we have to be careful of, if we're actually asking them to do as best as they could before COVID-19, or letting them, having time for them to actually slowly build up their confidence and getting back on track on things. So this is actually about easing students into the new in-person routine. This can take up some time. I think for international school students, they don't have the early summer break as the local students did, but this actually could the changes also affect their mental well-being as well. So we have to pay attention to signs that a student may be struggling, particularly students are vulnerable. So that's about the changes. the drastic changes from the normal behavior? Are they actually withdrawing socially? If they're being talkative usually, and then they're not going out with the friends anymore, or chatting with the friends anymore, this may be a warning sign. And lastly is actually to provide students opportunities to take a break if they are overwhelmed. Because usually for students in Hong Kong, we tend to, have very intense learning patterns, and then they don't really have time to take a break, especially during online learning as well. This is all about sitting at home in front of the computer and then just doing lessons, back-to-back lessons actually. But then with in-person learning, this actually could be a little bit different. We have breaks in between lessons, and they may be able to get around and then go to the tuck shop or etc. to take a break if they feel needed. So what teachers can actually do with the students at school, we have two simple exercises. So this is actually about an adaptation of what we call bite back. So this is actually a material devised by the Black Dog Institute in Australia, and they have a series of 8 modules for teachers to do with the students. And we're introducing 2 of them to you today. And so this is actually about gratitude, for example, first of all. It is about the positive feeling that you get from showing appreciation for good things that happen in your life. So this is not just about saying thank you or having good manners, but more importantly, it's to create or build a habit for being thankful and seeing the bright side of many things. For example, you can ask your students to write down 3 things, as small or large as they want, that they are actually grateful for. For example, in this example on the slide, you can ask them to write something about my friend who helped with me with my math work, or my parents who packed me a delicious lunch, or my pet who is an excellent snuggle buddy. So this is actually, no matter this is small or large, we can be grateful for things happening in our daily life. For example, someone doing us a favor, opening a door for us, a nice sunny weather like today, or the bus or the train showing up on time. We have a friend or a teacher noticing us when we don't feel very well. So all these actually is about building a habit with the students. And what does gratitude do for us is that it helps us focus on positive emotions and to feel more alert and focused. Because as Pinky mentioned just now, a lot of times it's lack of concentration, withdrawing socially, and then affected by the physical pain or muscle aches, etc. So this actually gratitude exercises, it stops us from ruminating when we dwell on bad things for too long and we don't even notice it. And this can help us sleep better at night, to have better relationships with people. And the second exercise is actually about healthy lifestyle, also of building a habit of healthy lifestyle. For example, setting SMART goals for 3 areas of healthy lifestyle, and invite your children to set theirs with you, or your students. For example, the exercise, diet, and sleep patterns. How you can actually do this, ask them to create this list of goals at the start of the year, and then maybe review it after some weeks or at the end of the term. And this actually can help them to create a healthy routine. So about SMART goals, I think most of the teachers, about this already. But just to be, summarizing, SMART goals is about realistic and achievable goals. For example, like exercise, you will aim to do at least 30 minutes of mild to moderate, physical activity a day. But for sleeping patterns, we would like to do with less screen times, for example. So this is something that you also can ask your children or your students at school to do with you. And lastly, this is also about seeking self-care, not seeking out, self-care activity for teachers as well. You can also do this with your students. So this is actually called the Lazy 8 breathing exercise, where this is about breathing in slowly for perhaps 4 seconds, and then you breathe out slowly for another 4 seconds. So you start from your palm in the center, and then you breathe in, you can close your eyes, and then breathe out. And then you can also do several rounds as well. This is about being fully present in the moment instead of being caught up in the past or in the future. So anyone can do it. You may have done it before without knowing what it was. And when you do this, you can also introduce this to your student if they cannot focus or concentrate at that moment. And this is also helpful because it only takes you like 8 seconds to do it for a round. So you can also try to help your student to connect what's inside of them, their emotions, the thoughts and feelings, and also what's outside of them in terms of like the environment, the sounds, the smells, the sights. So this is actually with the goal to let ourselves know these things that are happening without being worried about them. Being teachers, we are very stressful to deal with a lot of different kind of severe mental situations of students sometimes. When we're taking their problems, we also need to release our stress as well. So this is about having self-care properly. We have to take care of ourselves before we can actually take care of our students. So this is very important for us to do some self-care exercise. And then, okay, so we also have some kind of tips of where to seek help for educators as well. A lot of us actually struggle with different kind of occupations, psychiatrist, counselor, CP, social worker. So what do they mean actually? So for psychiatrists, they are medical doctors who specialize in medical management, risk, admissions to inpatient services. So they can prescribe and review psychiatric medication. So they are the only one who can do medications for patients, not clinical psychologist or social worker or counselor. And for counselor, on the other hand, it's about training. They're actually training, getting a training degree or master's degree usually in counseling. They're trained to talk to people experiencing distress and mental health problems. So they help them to process their upsetting experiences and stressful life events by speaking to you one-on-one, usually in a case setting. And for clinical psychologists, usually in the UK and the US, they have doctoral training qualification with a broad range of experiences, and they use talking therapy for mental health problems. For example, there are a lot of different types of talking therapy, CBT, like clinical cognitive behavioral therapy, ACT, like acceptance and commitment therapy, etc. So they can use a formulation perspective to help you understand why you feel feeling a certain way, rather than offering a medical diagnosis. Although they can diagnose people with mental health situations, they mainly do also one-on-one talking therapy with you to help you understand what you are actually going through, to help you think about why you're feeling this way. And then for social worker, they're actually more trained to assess and assist people with physical and emotional needs. They are usually the first, the gatekeeper at school whenever there are, students in need. Teachers will also refer them to the school social workers. In secondary schools in Hong Kong, we have at least 2 social workers in secondary schools. Primary schools, at least 1. And I think some of the international schools, they have CPs, clinical psychologists, or maybe the educational psychologists as well. But the social workers, they usually help the less advantaged people to look for the right resource in the community to help them continue sustainably the mental health recovery journey. So maybe they will be referring out to the children and youth centers in Hong Kong. So when we know about different kind of the roles of different professionals of mental health field, we can also take a look at the seeking help process in Hong Kong. So for schools, it's actually usually starting with school social workers or counselor, we call them, or guidance teacher, and then they will actually depend on the severity of the student. They may perform counseling themselves or refer to the school social worker or other than the schools, outside of the schools service centers. For example, the Integrated Family Service Center, the IFSC, or Integrated Children and Youth Service Center. These are actually well equipped with social workers as well as counselors to provide counseling or, kind of the psychotherapeutic interventions for them. And they will also, depending on the severity, refer the students to maybe seek help from a psychiatrist if they need medication, or a psychologist if they want more in-depth and more clinical formulated talking therapy sessions. So, well, for those who are more well off, they can actually go to the private services directly and they can contact whatever or whichever type of service that they choose. But for those who are less advantaged, they can also seek help in Hong Kong through the Kelly Support Group, Project Connect, or different kind of online counseling platforms. So these are all the services that are available in Hong Kong, and you can find these all hotlines, services in our website as well. And lastly, it's about taking care of our own well-being. So this is a very stressful time for all of the teachers, particularly for those who are charged with, supporting young people and dealing with constant changes to workflow. So we have to be aware of how we are doing. If we have concerns over our own exposure or impacts to our family or increased workload or of remote teaching, this is actually some kind of things that we would want to be aware of. And some signs that we are struggling is, this is actually, we have mentioned earlier before, for example, lack of interest, motivation in work. But for teachers, I think the signs, specific for teachers is difficulty in sleeping, appetite, and also conflicts in your personal life. So how do we take care of ourselves is to make sure that we connect, be active, take notice of ourselves, keep learning and give. So all these kind of things, the most important message is that we would want to really settle down and take a deep breath and reflect, take some quiet time ourselves to notice our feelings, acknowledge what we are feeling, no matter it's negative or positive, and to embrace them by maybe doing a mindful lazy 8 breathing exercise, and to keep embracing new experiences and give our time, words, and presence. So these are all very kind of, you're thinking of this is a very generic tips, but a very useful one is actually doing the exercises that we actually mentioned just now, the gratitude, developing healthy routines, and mindfulness practices. So we have some helpful resources. This is towards the end of our presentation, but we want to share with you some of the helpful resources for teachers as well, to know where to seek help or how to guide the parents or students at school to have a better mental well-being. At Mind Hong Kong, we have the free open access bilingual website where you can see a lot of different mental health situations, the signs and symptoms, the factors, the impact of a range of mental health illnesses. So that's called Mental Health A to Z. But more importantly, we have the COVID-19 mental health resources and a virtual assistant called Help Me. And for Cool Minds website is also bilingual, open access for free. and you can see a lot of different mental health resources for parents and educators as well. And then some youth blogs, and we have this clear help seeking tool, which is actually like this. We have this mascot here. It's a little cloud where it's a help seeking interactive pathway. You can click on it. It's bilingual. At the end of the pathway, you will see different kind of simulation rooms with youth themselves sharing their own recovery journey or help seeking journey in Hong Kong. And for COVID related information, feel free to go to the Mind Hong Kong website. And these can be very, a self-care resources for educators as well. Lastly, we have some upcoming events. For example, the Cool Speaker Series. This is actually a 2-day workshop for students aged 16 to 23 to share their own mental health journey. If you know any of the youth that you work with, they are actually experiencing or have recovered from mental health situations and they are willing to share, we would welcome them to join us to be trained to share publicly, how to share safely for others. This can help reduce stigma as well. And so this is, we have come to the end of the workshop and we have time for some Q&A if you have any. Yeah, and then feel free to connect with us on IG, Facebook, and our website as well. All right, so let's see if we have any feedback or questions.
So please feel free to ask Pinky and Nicole some questions if you have.
While you're thinking of questions, maybe I'd like to add that this webinar today, it's 1 hour and it's actually focusing on COVID-19, how COVID-19 affect students' learning only. So usually you can see from our website, we do a lot of workshops, mental health literacy workshop with schools. And for educators, we usually a 2-part series with educators. So it's 1.5 hours each with more critical tips for you to talk to students in need with role play exercises and group discussions. So if you are interested in joining us for that kind of workshops, please feel free to, I can also arrange with Sylvia because that is actually a more in-depth version of how you can actually active listening prompts, how you can use those kind of words or phrases to talk to students in need, how to initiate a conversation or address their concerns.